A tummy tuck operation is another commonly requested operation, usually following childbirth, occasionally following massive weight loss. I think before considering a tummy tuck, it's important to make sure that you've completed your family. There's no point having an operation and then stretching it all back up again. So once a lady's finished having children and it's taken its savage or ravages on on her tummy, then the various elements can be restored. The three common things that we see with a typical tummy tuck patient is that the skin has got stretch marks on, there's some redundant skin falling forward, a redundant apron of skin, and the tummy muscles themselves, the six-pack muscles, are often stretched apart, resulting in a bulge. The operation starts with a low incision to leave a very low scar that's hidden in a bikini area, and then the skin is lifted up and we can address that redundant muscle by stitching it together. You know, when you sit with your tummy held in and you've got a nice flat tummy, we can stitch the muscles together so it maintains that look permanently without having to think about it. The redundant skin is then pulled down and trimmed off, and that removes most of the stretch marks, but not always all of the stretch marks, and it results in a nice tight tummy appearance. When considering a tummy tuck, in order to prepare for your operation, there's several things that you can do. One is to optimise your weight, get your weight down to your ideal weight. If you're still carrying a few pounds and you have your tummy tuck and then you lose the weight, then the skin will get a little bit softer again and then you'll be disappointed. So work on the weight. The second thing to do is to get yourself as fit as possible. Work on the tummy muscles. Any operation is quite an arduous procedure, and the fitter you are, the easier the operation and the recovery period will be. And the third thing doesn't apply to everybody, but if you smoke, you must stop. It's an absolute prerequisite. We see far more complications in people who smoke, and most plastic surgeons will insist you've got to stop smoking or no tummy tuck. When somebody wakes up after a tummy tuck, the degree of discomfort's variable. It's difficult to predict for any one lady what it's like. It's more discomfort than pain, and there's always regular painkillers available. Most surgeons will put a small catheter into the bladder so you don't have to get out of bed that night, so you get a nice comfortable night, and then the catheter out the next morning. And my patients all mobilise the following day. And nowadays I'm using a fibrin glue so there are no drains to come out, so the patients can go home on the first post-operative day. Usually moderately comfortable. I like them all to wear a little corset just to keep a bit of pressure on. It's important when recovering from any operation to invest time in the recovery and don't try and do too much too soon. A week at home, you'll need somebody at home with you because you're not going to be fit for making your own meals. And in fact, I would say if you wanted a cup of tea, don't try and do it yourself. The second week, you'll still not be returning to work, but you'll be gradually increasing what you do, returning to normal light activities by about 2 or 3 weeks post-operatively. After 3 weeks, most people are ready to go back to work. By 4 weeks, you can normally do light exercises in a gym, and by 6 weeks, you're normally fully recovered from the operation. With a tummy tuck operation, it's generally a safe, simple procedure, but there's always certain risks that need to be considered. We can minimise the risks by making sure that the weight is reduced to normal and that the patient stops smoking completely before undergoing surgery. The commonest issues that we tend to see after surgery is the lower tummy skin is relatively numb after surgery and you can't feel it. With time, over 6-12 months, that numbness recedes to a very small area of numbness just above the scar. The second commonest thing that we see is the wound sometimes gets a little wound infection and the wound can open up a little bit, and that can look really frightening, but there's no need to panic. It will gradually get better on its own, and most of those little areas that have opened up normally heal within 3 weeks, 4 weeks, 5 weeks, 6 weeks. The longer sort of recovery period tend to be those ladies who have been smokers and stopped smoking, so it's all about blood supply to the area. It's very unusual to bleed underneath the tummy tuck flap, but that can happen maybe once in every 100 patients, and maybe 5 in every 100 patients may get a bit of fluid underneath there, which may need to be sucked off in the outpatients using a very small needle. And I always tell people you won't feel the needle, and nobody ever believes me. And then they go, "Oh, I didn't feel that needle." So it's a minor complication. In terms of devastating complications, that's very unusual. But occasionally you can lose part of the skin of the lower tummy. That tends to follow on from an infection, and again that's much more common in ladies who have a sneaky cigarette afterwards. I keep coming back to that, but it's a critical part of the operation to stop the smoking.